Section 4 of the periodical evacuations. Women in the unimpregnated state are subject to a certain evacuation, which recurs periodically, generally every 4th week, more frequently in some, and more seldom in others. This discharge, called menstruation, commonly commences about the 14th, 15th, or 16th year, according to the growth of the body and of the uterine system. It usually ceases sometime between the 40th and 50th year, soonest in those in whom it appears earliest. The periodical evacuation continues in general for 3, 4, or 5 days, during which time the quantity discharged is from a gill to half a pint. It is, however, liable to considerable variation in quantity and time of duration in different women and in different climates. The commencement of the periodical evacuation introduces an important change in the female constitution. It ought, therefore, to be viewed as a critical season, which demands a greater share of attention than is generally paid to it. Many diseases, which had previously resisted the power of medicine, often abate or disappear on the regular establishment of that evacuation. The management of young women at that tender and critical age ought therefore to be particularly attended to. The revolution which the periodical discharge induces in the female constitution is not effected at once. A number of preceding complaints announce its approach. A general languor and weakness, depraved appetite, impaired digestion, frequent headache, and hardness and tightness of the breasts often distress young women several weeks or months before the discharge appears. These symptoms require the use of those remedies which tend to strengthen the general habit, such as nourishing diet, small doses of light bitters, preparations of steel, particularly in the form of mineral waters, together with variation of scene and moderate exercise in the dry open air. At the same time, late hours, fatigue from dancing, exposure to heat, or long confinement in crowded places, and irregularities of every kind ought to be prohibited in these strongest terms. If, however, notwithstanding such treatment, or in consequence of any imprudence, the health should become much impaired and the body wasted, there is the greatest reason to dread hectic fever, a disease of the most alarming nature. Many young women in such a situation are daily lost from neglect or from not having early recourse to the advice of practitioners of midwifery. After the periodical evacuation has been perfectly established, its approach is generally announced by one or more of the following symptoms: fullness, tension or pain in the breasts, pain or giddiness in the head, a slight degree of nauseating sickness, pains in the belly and loins striking downwards, heaviness and weakness of the eyes, with a livid circle under the eyelids, together with a general languor. The greatest number of women are occasionally subject to some of these symptoms, though a few suffer no deviation from the usual fate of health. When there is reason to expect the periodical evacuation, everything which may discompose the mind or body should be carefully avoided, particularly passions of every kind and exposure to cold or violent exercise or fatigue. The food should be plain and simple, such as may not overload the stomach or disturb the bowels. When any of the symptoms which precede the discharge, such as pains in the head or back and loins, continue violent for a considerable time, the feet should be bathed in warm water, and some weak, warm white wine, negus, or whey should be drank. There are many disputes about the causes and uses of the periodical evacuation. These subjects are inconsistent with the nature of this work. My name is Brooke Fox. I am MUSC University Archivist, and I have been reading passages from The Family Female Physician, or a treatise on the management of female complaints and of children in early infancy by Alexander Hamilton, MD, Professor of Midwifery in the University and Fellow of the Royal College of Physicians and of the Royal Society of Edinburgh.